हेलो एवरीवन, दिस इज सुलमान फिरोज। आई एम एन एक्सरसाइज फिजियोलॉजिस्ट एंड कायरोप्रैक्टर। आज की इस वीडियो में मैं आपको मिलवाने वाला हूँ एक पेशेंट से। इनका नाम है आदम और ये जी हमारे पास यूके से तशरीफ़ लाए हैं। ये रोड ट्रैफिक एक्सीडेंट में इनको जो है अपर बैक में और लेफ़्ट शोल्डर में पेन थी और इनकी रेंज ऑफ मोशन काफ़ी रिस्ट्रिक्टेड थी। तो आज इनका 3rd कंसेक्टिव सेशन है और ज़रा इनसे पूछते हैं इनकी तबीयत कैसी है।
Assalamu alaikum, my name is Adam. I'm come from all the way from the UK. To be honest, I wasn't too sure whether to come, but my cousin recommended to come to this place. I had a problem with my shoulder. I was involved in a car accident. I got many treatments done in the UK, however they wasn't very successful. But visiting doctor, I feel much better in terms of my range of motion and also the direct pain that I was having in the front of my shoulder.
What about the tenderness?
Basically, my shoulder used to feel very tight, sort of lifting or trying to carry anything in front of myself. But now it does feel much stronger. Of course, the stability the doctor was explaining to me, the stability will take quite a long time to fix, and he has given me various exercises to do in the meantime.
And what about the range of motion? Can you move your hand properly?
Yeah, it's much better now, especially in terms of touching my back. It's a lot better.
Okay, I'll push this downward and you have to resist.
Okay.
Resist. Make a fist. Resist. 1, 2, 3. Is it painful?
No.
Okay. This is our painful hand. Okay. Resist. 1, 2, 3. We still have weakness. Resist. Okay. Relax. Breathe out. In. Breathe out. Okay, lay on your tummy. Okay, the alignment is pretty much perfect. Is it our 3rd day?
Yes.
Breathe out. Exhale. Exhale. Again. Relax. Good. Now on your back. ठीक है?
Yes.
relax. The other side. Relax. जी जनाब, how are you feeling?
Feel good.
Feel good?
Light.